Heart sounds are important indicators of heart health. They include the lub and dub sounds that mark the heart's rhythm. The first heart sound, S1, occurs when the atrioventricular valves close, marking the beginning of ventricular contraction. The second heart sound, S2, occurs when the semilunar valves close, signaling the end of ventricular contraction. In addition to these sounds, heart murmurs can occur, which are abnormal sounds due to turbulent blood flow. Murmurs can be classified as either innocent or abnormal. Innocent murmurs are harmless and often occur in children. Abnormal murmurs may indicate underlying heart conditions, such as valve issues or congenital defects. Healthcare professionals use a stethoscope to listen to heart sounds and murmurs. Proper technique is crucial for accurate assessment. Murmurs can vary in intensity and pitch, often described as a whooshing or buzzing sound compared to normal heart sounds. To evaluate murmurs, doctors may perform additional tests such as an echocardiogram or chest X-ray. Understanding heart sounds and murmurs helps in diagnosing and managing cardiovascular health.